Hello everyone, happy Friday. I'm sporting my new Mchd face covering, Why I Wear. And I wear to protect some neighbors that are ahead of me in years, and one that has had a liver transplant, and my 92-year-old grandmother. So that's why I wear. So please, everyone, continue wearing your face coverings and socially distancing when you're out and about to protect those more frail and medically fragile people in our community. So I'm Rendi Murphree, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department, here to give you our Friday 2:30 update on the impact of the COVID-19 pandemic on Mobile County, our residents, and our visitors. So worldwide, more than 19 million cases of COVID-19 have been documented, with 716,000 COVID deaths. In the U.S., we are approaching 5 million cases, so about 4.9 million cases with over 160,000 deaths. This morning, Alabama reported 94,827 cases with 1,674 deaths. In our daily report that is done in partnership with SSI Group here in Mobile, we're reporting on 9,692 cases of COVID-19. Yesterday, 163 were reported to us. Among those, 214 have died. That was an increase of 2. Looking at the AIMS data, cumulative number of hospitalizations for COVID-19 stand at 1,451. And yesterday in the hospital, or currently in the hospital, it's around 170 people with COVID-19. Let me just point out a couple of other things in our daily report. And you guys know that we can't change these things on a dime, right? So when you make a suggestion or ask a question or notice an error, then we try to address that as quickly as possible. And so just to know that we are listening. So finally, in our daily report today, it reflects the new age groups: 0 to 4, 5 to 17, 18 to 24, 25 to 49, 50 to 64, and 65 and over. Again, so that we can track the number of cases in that K through 12 age group, and then in that college age group of 18 to 24. We also added the number of patients with race that were unknown to the bar chart, so you can see it there that the majority of our COVID cases have race as unknown. And the reason behind that is that hospitals and laboratories are really good about reporting age or date of birth and sex. And race is not reported as frequently by hospitals and laboratories. And since we are overwhelmed with the number of cases and really having a difficult time to contact everyone to find out their race, that's why we have such a large unknown in the race category. Also in the report today, on the third page, which is a new page for us this week, we reported that yesterday 102 people were hospitalized in Mobile County hospitals with COVID, but in our key performance indicator, so this little summary box, it said 170. So several of you noticed that 170 didn't match the 102. Our public report has all the bars are blue, but we're trying to make some modification here. What happened is yesterday, one of our hospitals did not report. So that's what made this bar look so much smaller, because we had one rather large hospital not report. They had 68 cases on this day that were not reported in the bar. And then when this indicator was calculated, it actually pulled the number from that hospital from the prior day. So still the hospitalizations are about 170, but we've made some modifications already to this report so that you will know when one of these bars includes data from less than 7 hospitals. So we'll work on that. All right. We generally on Friday tell you how many complaints we got for food and lodging establishments or permitted establishments. It could be, tattoo parlors or any other of our permitted establishments. So this week we responded to a total of 19 reports. A little shift this week. Only 7 of those were food and 12 of those were retail. So thankfully people are beginning more and more to comply with the state mandate to wear a face covering, and we're receiving fewer complaints about that, though we still do get a lot. Right. One question that came up about permitted establishments, particularly restaurant, a question came in that says, do the state and local rules on masks for restaurant employees require masks when the employees are not working 6 feet from customers? So for instance, kitchen workers, the kitchen worker kind of goes all around in the restaurant that this person was in, but they were not wearing masks. So here is the response from our district manager of inspection services. So the current order from the state in paragraph 19 only requires restaurant employees who have regular interactions with patrons to wear masks or facial coverings. Paragraph 2 deals with required facial coverings for individuals, but it is not a mandate on the business itself, only the individuals. This is something that Brad continues to educate us on, that the mandate is for individuals. So kitchen workers or any other employee who do not directly engage with the patrons are not required to wear masks, but they are highly encouraged to wear facial coverings or masks. So Brad can always say it better than I can, so I'm very happy when he responds to a question in writing, and then I can read it on Facebook Live. One of the things I want to mention about the 6'15" rule is, so this is talking about close contact. So we have been defining close contact for a really long time as being within 6 feet of someone for 15 minutes or more, and we kind of stop there. So I'd like to continue that sentence because we've had some confusion lately about it. So it's within 6 feet for 15 minutes or more while the person is infectious. And the infectious period from the time that they're infectious until the time that they are diagnosed and they isolate themselves, that can sometimes be a couple of days because they could be infecting people 2 days prior to symptom onset. So the rest of that sentence is within 6 feet for 15 minutes or more during the person's infectious period. So that 15 minutes is not necessarily continuous. It is a cumulative 15 minutes. So if my coworker that I was within 6 feet of, if I was close to within 6 feet for 5 minutes in the morning and maybe 5 minutes or lunch and then 5 minutes while we're waiting to clock out, that would be a cumulative exposure of 15 minutes. And then that would put me in the category of being a close contact. The other thing that I want to be sure to clarify is the 6'15" rule applies whether you're wearing a mask or not. So even if I have my mask on, and let's say I'm wearing it properly over the bridge of my nose and under my chin, if I'm within 6 feet of someone for cumulative 15 minutes or more, I'm still considered a close contact. I just want to make sure to make that point. We do frequently, but it always helps to remind. Okay, on to some questions. We don't have any from the media today. Wow. Okay, special Friday for me, no media questions. All right. We got an email from someone asking us about why the daily report did not have the age breakdowns. We have since included that. It just takes a little time for us to get that automated process modified and go through the clearance process. Here's some from Facebook. A comment that knowing the % positive number of laboratory tests is a really good indicator of how we're doing as a community, and they would like to see that data on a daily basis. And really, we have looked at it on a daily basis, and you cannot make hide nor tail of the data because it fluctuates so much on a day-to-day basis for all of these reporting reasons that we talk about: delays in reporting, delays in testing, a lab may be dumping a bunch of lab results on Thursday when they forgot to send them yesterday. Usually that doesn't happen, but occasionally it does. Right now, we have heard from the state health department that due to a change in the information that's required from laboratories, a change that was to go in effect on August 1st, the Alabama Department of Public Health has seen a drop off in reporting from some labs, and they're worried that change in the type of information that was submitted, maybe some labs thought that since they couldn't supply that info, they just should stop reporting. So those things do happen. So those are the kinds of artificial things that influence the counts, and influence our decision not to report those on a daily basis, but instead try to calm that noise by looking at it on a weekly basis. All right, here is another question from Facebook. If you are quarantining at home and develop symptoms, who should you contact? Well, if you can manage your symptoms well at home, then you don't have to contact anybody. Just let the people in your household know they have to stay away from you and don't take any visitors and stay home. But if you can manage your illness at home, then please do so, because we would rather you not be moving about the community, potentially infecting others. If you cannot manage your illness, then please at home, please contact your healthcare provider before seeking treatment in an urgent care or in an emergency department or in their doctor's office. Call ahead to say you had been exposed to COVID, you now have symptoms of COVID, and you need to come in because you're having some of those, signs of complications like shortness of breath or shortness of breath, difficulty breathing. That's kind of the same thing. But you just let your body will tell you if you're not able to manage those symptoms at home. You start having chest pains, things like that, then call your provider and let them know you're coming in. You don't have to contact the health department. So that you can if you want to, but you don't have to contact us. We generally will find out about you through laboratories or providers. Here's just a comment that someone's husband has a underlying condition that makes it difficult for him to breathe, and he can't wear a cloth face covering or a mask, and his nurse recommended that he wear a face shield. And we have another question say, what are your thoughts about face shield instead of face mask? We could get those two people together and they could have a conversation. So yes, if you cannot tolerate a face covering or a face mask, then wearing a face shield will give you some protection. The challenge is because usually a face shield comes to about here, you can still have some respiratory droplets that may, escape out from the underneath of the shield. But still, wearing a face shield is better than not wearing anything if you particularly have an underlying condition that affects your ability to, take in oxygen and stay healthy. So let's see. Okay, this last comment is about the bar graph that had the race, and we have responded to that request by adding the information on the number of people with unknown race. Anything else? All right, it looks like our queue is cleared for today. We will be back with you Monday to give you Monday's update on the number of COVID in Mobile County. Thank you.